Corona means crown and is given the name to coronavirus because they have spike-like crowns when seen under microscopes. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. People around the world commonly get infected with these 4 human coronaviruses you see here. Sometimes coronaviruses that infect animals can evolve and make people sick and become a new human coronavirus. 3 recent examples of this are SARS, MERS, and the one currently spreading worldwide, SARS-2, aka coronavirus disease 2019. The SARS-2 virus is a beta coronavirus, like MERS and SARS. All 3 of these viruses have their origins in bats. This is what the CDC believes happened. A bat infected with the virus bit some wild animal. The virus mutated in the wild animal and was able to infect a human or humans when they ate it. Early on, many of the patients at the epicenter of the outbreak in Wuhan, China had some link to this market, indicating animal-to-person spread. Later, a growing number of patients reportedly did not have exposure to animal markets, indicating person-to-person spread. Person-to-person spread was subsequently reported outside Wuhan and in countries outside China, including in the United States. Much like SARS in 2002-2003, which was caused by a similar coronavirus to the one now emerging worldwide, there was a temporary ban on wild animal markets. China has once again suspended the buying and selling of wild animal products. We're still not sure which animal it came from, which is making it difficult to create a vaccine. The virus spreads between people who are in close contact with one another about 6 feet, through respiratory droplets when someone coughs or sneezes. The virus can cause respiratory tract infections that are typically mild, though rarer forms can be lethal, such as SARS and coronavirus 2019. Coronavirus 2019 is a type of coronavirus that affects the respiratory tract. Remember, the virus causes you to cough. The main way the virus is spread is through droplets, so coughing and sneezing. These droplets can land in the mouths or nose of people who are nearby or possibly be inhaled into the lungs. It also may be possible to spread the virus by touching a surface or object that has the virus on it and then touching your own nose, mouth, or eyes, but this is not thought to be the main way the virus spreads. Coronavirus disease 2019 is spreading easily and sustainably in the community, and community spread in some affected geographical areas. Community spread means people have been infected in an area, including some who are not sure how or where they became infected. As you can see in the chart, coronavirus is more fatal than the seasonal flu. The following are symptoms of coronavirus disease 2019: fever, fatigue, dry cough, and coughing up mucus. The way to tell the difference between the seasonal flu and coronavirus is that coronavirus does not cause runny noses. Older people and people of all ages with severe underlying conditions like heart disease, lung disease, and diabetes, for example, seem to be at higher risk of developing serious coronavirus disease 2019 illness. Widespread transmission of coronavirus disease 2019 could translate into large numbers of people needing medical care at the same time. Schools, childcare centers, and workplaces may experience more absenteeism. Mass gatherings may be sparsely attended or postponed. Public health and healthcare systems may become overloaded with elevated rates of hospitalizations and deaths. Other critical infrastructure such as law enforcement, emergency medical services, and sectors of the transportation industry may also be affected. Healthcare providers and hospitals may be overwhelmed. Some tips from the CDC. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if coronavirus disease 2019 is spreading in your community. This is especially important for people who are at a higher risk of getting very sick. Stay home if you are sick, except to get medical care. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, again, use alcohol that contains 60%. Wear a face mask if you are sick. If you are not sick, you do not need to wear a face mask. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks.